Good afternoon, everyone. I'm Erin Frederick, and I'm a Senior Program Officer with the Zilber Family Foundation.
Good afternoon, everyone. I'm Mark Huber, and I'm the Senior Vice President of Social Responsibility for Aurora Healthcare.
I'm Joy Tapper. I work as the Director of the Milwaukee Healthcare Partnership.
Hello, I'm Janelle Hines with the Greater Milwaukee Foundation. I'm the Director of Grant Programs and Strategic Initiatives.
I'm Doncia Stronghill, LISC Milwaukee.
Okay, as Ken talked about, and I think all of us are well aware, not only are many more children growing up in poverty than were decades ago or even a decade ago, they're also growing up in a more persistent, more intractable, less hopeful form of poverty than we've experienced before. Many of them, as a result, have very poor health status. What are your organizations working on to help address some of these issues?
Starting with me.
Anyone who wants to start. It's the lightning round.
See, I strategically left this seat open, hoping that Doncia would come and sit there, but she smartly went down that way. So I'll take a stab at it. As I mentioned, I work for the Zilber Family Foundation, and I primarily work with the Zilber Neighborhood Initiative, which is a 10-year, $50 million commitment to improve the quality of life in disinvested neighborhoods in Milwaukee. So it's a place-based approach. We've heard a little bit about place-based approaches today. And real quickly, I'll say at the beginning, we went through a community planning process with the neighborhoods we work with, Lindsay Heights on the north side and Clark Square on the south side. And those communities gathered people who live, work, and serve in the neighborhoods to develop quality of life plans. In these plans, there were strategies, and people saying what they thought needed to be done in their neighborhoods to improve the quality of life. So really, as a foundation, what we've done is to support the people who live, work, and serve in neighborhoods to say, this is what it's going to take to improve the quality of life in our neighborhoods. And several of those strategies revolve around health and wellness. And neighborhoods define those in different ways. So we really, I think my key point here is we really come in support of the people who know the neighborhood the best. And one of the speakers said this morning from Dr. Cooper's book, what you see depends on where you stand. And I think, I haven't heard it said like that before, but that really rings true, I think, to the foundation and the work that we do. I'll also give a quick plug for data and Katie Pritchard, because we've supported data you can use and data because we've heard from our partners that data is important. And then, in the interest of time, I won't go on, but I would say we fund a lot of programs, projects that support the social and economic factors that you've been hearing about today, and the physical environment, meeting basic human needs, increasing access to social and economic opportunity.
Next. I had a whole laundry list of programs and examples I was going to give here, but in the interest of time, I think I'm going to approach this more from a systems level and go back to something Ellen Sexton said at the very opening of this session this morning. And she said, we need to think beyond care as just being medical care. And how are we addressing that at Aurora? And really, we started down that path at Aurora over 20 years ago when we brought one of Milwaukee's largest social service agencies, Milwaukee Family Service, into Aurora. And it's served with us since then as Aurora Family Service. And what that has done is two things. First of all, Aurora Family Service operates out of a model of family-centered care. So when we talk about social support networks for the patients, working with Aurora Family Service, what we really do is look at that whole family. We don't just look at patients as individuals. We bring in their family, however they define their family, into that discussion of how can we address their specific needs, whether that be in our clinic or in their homes. And the other thing that really, from a systemic level, AFS has brought to the table for us is the ability to start to integrate social services into our medical teams. So we're doing a lot of work over the past 3, 4, 5 years on adding social workers onto our medical teams in the ED, in primary care settings, in women's health settings, across our system to look at healthcare and healthcare planning for our patients beyond just the specific medical needs and bringing in social determinants and bringing in specific strategies to address those social determinants among our patient populations. And so I'll talk a lot more as we get into some of the other questions about care coordination and some of the specific initiatives we're doing in that regard.
Thanks, Mark. I think many of you know, and I see many of the members of the partnership here in the audience today. The Milwaukee Healthcare Partnership is now an 11-year-old public-private consortium that has stayed with the same mission since its inception, and that is to improve health care for low-income vulnerable populations in Milwaukee County. And very important given that about a third of the population in Milwaukee County and almost 50% of all kids are enrolled in Medicaid in our community. And we have another 8 to 10% of the population that's uninsured. So almost 40% of the population would be classified in that arena. The members include those organizations that have a direct impact on care delivery and a direct accountability for care delivery in the community, including the four Milwaukee Health Systems, Freighter, Aurora, Children's, and Ascension, 16th Street and the 4 other federally qualified health centers or community health centers in Milwaukee County, the medical college, and then the city, county, and state health agencies. And we also do affiliate work with many other provider organizations, including the Free Clinic Collaborative, representing 25 free clinics in Milwaukee County, a number of other community-based providers, and increasingly, and to move toward greater alignment, are eager to work more closely with Medicaid managed care organizations and other payers in that space. We organize our work in 3 categories. What are the things that we sponsor? What are the things that we can collectively improve? What are the things that we participate in that someone else, some other sector in our community has the expertise and we partner with them? And what are the things that we monitor, are issues or concerns that are interrelated to our objectives, but don't have the bandwidth to address. So our goals are focused in 4 areas. One is to secure and retain adequate and affordable coverage for individuals, and just really proud of the work that everyone in this room has done to increase enrollment and reduce our uninsured rate in this community by 46% in the last 3 years. The second goal area is to improve the availability and accessibility of services, including primary care, specialty care, and a particular focus in these last couple of years on behavioral health access. The third goal area is care coordination. It's not enough to have, we know insurance does not equal access, and even the availability of services doesn't equal access. So how do we assist with navigation and coordination within and across the delivery system? Our key signature activities there are our emergency department to medical home initiative, and more recently, looking at how can we leverage the health information exchange, WISHIN, to be able to exchange information among care providers. And then our fourth goal area, which actually came to the table in about 2014 with the growing awareness out of the Affordable Care Act, is to participate actively in community health improvement or population health issues and initiatives. And we've selected, driven by our collaborative community health needs assessment, 3 areas of focus right now. One is through and with United Way and the Life Course Collaborative being focused on infant mortality and what's the role of the healthcare sector in that space. A second area is focusing on improving early childhood immunization as part of the bigger multi-sector collaborative Milwaukee Succeeds. And then third and emerging is looking at what is the role of health and healthcare providers in violence prevention, intervention, and we're just beginning to embrace that blueprint and understand what is ours to do.
So the Greater Milwaukee Foundation is a community foundation. That means that we are place-based. We primarily focus on 4 counties in our department, and that is Milwaukee, Waukesha, Washington, and Ozaukee County. So today, Ken talked a little bit about the social determinants of health and how those words are popular now, but the work that we do supports that for a very long time. So the Greater Milwaukee Foundation has been committed to increasing economic opportunities, strengthening neighborhoods, strengthening education, and regional vitality. We've been really intentional about looking at data and understanding why we are where we are today and what we can do about it, and also unpacking that data. I know that Katie mentioned that earlier because, and even Ken did too, you see a number, but when you go a little bit deeper in that number, you see the impact that it has, the disparate impact it has on people of color, especially in this community. And so looking at that and considering that, and also being intentional about calling out equities and inequities. Our work, we call it racial equity and inclusion. We are creating a frame to be able to lift this up and looking at people and looking at communities. So we are all in families, we stand individually. I know Dr. Gunn mentioned earlier that we all once upon a time were kids. Some of us still feel like kids today. But the point is, nobody works in isolation. So we own our part, right? I'm a really good teacher. I am a really good doctor. I am a really good economic development person. But if we don't bring those things together, we can't strengthen our community. So our work at the Greater Milwaukee Foundation has really been about bringing all those pieces together to strengthen it and provide care. But also changing how we do what we do, because it's not about us, it's about the people that we serve. And they are the experts, which we've all heard today, and we all really know that. But really, and we all heard today about voice and listening and action. People have voices. We just have to be more intentional about listening to what they say and believing what they say, because they have the solutions. So we've been really trying to change our work to be able to be more focused on culturally responsive practices and putting the people at the center of the work and the solutions and driving it. So changing what we do to be able to impact the community, because community isn't the same. Greater Milwaukee Foundation has been around for 102 years. What those problems were 102 years ago are not the same problems that we have now. But some of the root causes, thinking about the ogre story that Katie had earlier, we're trying to be more intentional about looking back to figure out what's going on. So we really need to be able to do 2 things at once, be able to pull those babies out, but also find out what's going on upstream. But also remember that that child did not come to this earth by himself, and he or she is not by himself now. There's a mom, there's a dad. Ken mentioned 3 generations, or might be a grandparent. But whatever that family looks like, we want to make sure we're showing up that family, because all these things contribute to our health. We tend to silo it and think health is really about going to the doctor or exercising or eating healthy, but all those things are created and connected to something else we do in our life. So the Greater Milwaukee Foundation is really trying to look at things broadly and be able to make connections in what we do and how we do it, and partner and collaboration is very important. A number of these people up here today are our partners, and Joy mentioned Milwaukee Succeeds. So it really is about extending what we do into the community, and it's so much more than just money, because there's not enough money.
So you asked the question about what we do that works with children, and LISC does not specifically work with children. And what we do is support and serve as the Community Foundation and Zilber's coordinating boots on the ground for all of the community groups that they work with. And that means pulling together all of the assets that are available in a neighborhood and in a community. I have been often pretty verbal about the idea that that you have a lot of work that's just being done with children, because those kids belong to families. You may not like their purple-haired mom, but she's their mom, and we have to work and support them. You may not want to deal with their father and his grill, but he's there and he's real and he matters to them. Those children live in neighborhoods, and those neighborhoods have been in distress. They've been in a community that has suffered from decades of racism and segregation, within a community that is within a city, that is within a dysfunctional political system. And all of that we have to work through so that we can help the children. And we do that by helping the families and the neighborhoods and the communities. LISC has been working in social determinants of health for the 50 years that we've been around. We just have never called it social determinants of health. But now that we are aware that the environmental factors matter as much to people as their hereditary, we can now call that work out and really focus intentionally on it and be able to name it and be able to change systems. So we really are about the systems change and about being not necessarily politically correct about the systems change, but about advocating for residents and practitioners who work with the residents to speak on their behalf, because like Angela Blackwell Glover says, the solution, those closest to the pain are often closest to the solution or have the solutions.
Thank you. Earlier, David talked about the violence prevention efforts, and he said something that really struck me, which was that sometimes it was easier to stop the violence than to get the different organizations to work together. Danzia, when you were responding, you talked about some of the things that LISP does to coordinate. I'm going to pitch this next question to you to start. What do we need to do to get organizations to coordinate better, and how can you as funders help advance that?
Thank you. So coordinating and collaborating among organizations is critical because, as Janelle says, there's not enough money. And so we can't chase grants anymore. We can't change what we're doing so that we qualify for the grant. But we really need to intentionally think about who's in what lane, who does what well, and how do we allow them to do that and then focus and help by doing what we do well. So at LISC, we have been trying through our grant process to encourage those organizations and collaborations that are working well together or have the potential to work together. I think funders, it would be helpful in some cases to fund the collaboration. I am very grateful that Zilber and Greater Milwaukee Foundation fund our operations because we work with other organizations to make sure that the collaboration is working well. This year at the Mandy's, which LISC hosts annually, we introduced the first ever award for collaboration by Northwestern Mutual. That will be a permanent award, and so to the extent that we can hold up someone or an organization that's doing good work and then partner them with somebody who has a need and not duplicative, I think that's how we head there.
So as a funder, collaboration, people tend to think that's a bad word because sometimes funders force it and people don't like that. And so we get it. And we get it loud and clear because we see ourselves as a partner. And you partner with people that you share a mission with and that you want to be able to contribute with to drive change. And so when we think about collaboration, we see our role in being able to partner people together. And sometimes partnerships work and sometimes partnerships don't, but we're not into forced marriages. We want to make sure that people date and find that they're compatible before they create a union. But we also not only try to support that, we try to be a part of the collaboration. So we model what we want to be able to see in this community, and sometimes it doesn't work out so well. Milwaukee Succeeds is a great example of something working out really well, but those are a lot of people who are at the table who aren't normally at the table, but they're brought together around a common mission to be able to make Milwaukee succeed and provide opportunity for kids from cradle to career. And that's what collaboration really is about. It's about identifying what that common mission is and figuring out your piece and moving it together. And we all can't, there might be 8 seats at the table. We can't sit in all 8 seats. A lot of us try to, but we need to figure out what seat, to use Dancia's, what lane is best for us, and to be able to move in that. If we're all pushing that together, we're going to be much more successful. And so that's what we try to do in collaboration, help to identify a mission to be able to move something forward.
I'd like to raise my hand and say collaboration is really hard. I think we've talked a lot, we've heard partnership, we've talked about collaboration a lot, but it takes a lot of work and commitment and a long-term view. I think there are so many structural barriers that prevent us from working together, not the least of which is just the polarization in our community and society in general, but categorical funding often does not cause us to work together, shortage of resources, optimizing our own organizations over the collective good, all of those things are real. They're real. And I've been learning a lot from Katie, others in the room about this whole science of the new buzzword of collective impact. And there's some key principles that I think I've just been trying to understand and embrace and we might all think about. One is that having a shared purpose or mission and really articulating that with a measurable goal as being a critical success factor for that. I think a second is sponsorship at the senior-most level, that if you don't have that buy-in, the recommendations sometimes can only go so far. So really getting that sponsorship at a senior level in your organization. I think a third is measurement. Ongoing evaluation is really critical for effective collaboration. Fourth is a work plan with really specific action plans and objectives. Collaboration just doesn't come without a purposeful agenda of how you want to get there. And then finally, collaboration takes resources. All of us have other full-time jobs, and you really need the resources to help guide and move the group together to make real collective change. And maybe the bottom line running through all of that, I would say, is authentic, trusting relationships which start with our own authenticity and behaviors. On the funding side of this, the partnership and Mark, myself, we kind of wear multiple hats in this work together. One, we're recipients of funds from the Greater Milwaukee Foundation, from other organizations. We're a funding conduit that solicits collective resources for multiple organizations for a common end. And then the Partnership Health Systems have created a shared community investment fund. So we, Mark, myself, others are part of a shared community investment fund team that's looking at criteria for the disbursement of that funds. And I couldn't agree with you more, both of you, that I think a funder's role is for us to really drive alignment, because we have a lot of initiatives going on and we need to drive collaboration through our funding resources.
Thanks, Joy. I was trying to think of the best example I could give in a short period of time, and we talked today about the incidence of infant mortality in this community. We talked about how stressors drive prematurity that drive infant mortality, and how violence is one of those stressors. And how do we work across the silos to really get at some of those issues at their interconnections? So at Aurora Sinai Medical Center, we looked at women who were presenting who were pregnant and self-identified as being in unsafe living conditions, and developed a program called Safe Mom, Safe Baby. And that was really designed to help women who are coming to us in these situations to navigate the health system, to navigate the law enforcement system as they want to help navigate the criminal justice system as may be needed. But one reoccurring theme that kept coming up as an unmet need was safe housing. And that was one where the most dangerous time for a woman who has a domestic violence situation probably is during a pregnancy, first of all, and then secondly, at the point when they're leaving. So if we don't have a safe place for them to go, that's really a high-risk environment. We have some wonderful shelters in town, but the shelters is not always the best match for the needs of every patient who's out there in the situation. So we started exploring outside of our comfort zone, because we're a healthcare system, we don't do housing, what options might be out there. And we've entered into a new partnership with St. Catherine's Residents and the Junior League of Milwaukee and Hope House and Aurora Family Service, where we have housing available for women for an 18 to 24 month period. We can give them a safe housing environment. We can provide social support to them through the Junior League and through AFS and Hope House and the wraparound services to help them move into the next stage of their life. It's only a starting point. We don't have the capacity that is needed to really bring this to scale. So I'm throwing this out there as a seed. We're looking for more partners to expand that program, but it's really making a tremendous difference in the lives of these women and their families.
All right, so as the last person to answer this question, I'll try not to repeat what others have said, but I guess what I would say is from where I sit, yes, there are silos, but I actually see several of the organizations we work with working well together. And that may be because of the way that the whole initiative started. At the beginning of the initiative, there were some organizations that were funded as our key partner organizations, and they, believe it or not, and Susan, correct me if I'm wrong, but they met weekly for the first at least year. So we were very intentional about building trusting relationships with those organizations. And I do recognize, they all had funding from us, so that kind of released some of the competitive fear or whatever's going on. But I think we have always been very intentional about building those trusting relationships between our grantees and also between ourselves and our grantees. So I would answer the question in the way of actually what can we do as funders? And some of you have already addressed that, but again, providing resources for collaboration. I think by providing general operating support as a funder, you're actually, collaboration and relationship building takes time, as we all know. So providing general operating flexible funding really allows for organizations to maybe be able to spend some time building relationships. Addressing power dynamics. We know we come into the room as funders, but hopefully because we've spent time developing those trusting relationships, we can address those power dynamics and the privilege that comes with being able to give funding to support important work. And then, again, I'd go back at the risk of being redundant and just say, if all of us as funders and organizations can listen to the people who are the experts, as Katie mentioned, those moms in the village who were brought together to talk about the nutrition in those kids that were doing better than others, those are the experts.
And to be able to not actually provide any sort of safety net, regardless of what it looks like or how strong it has to be. But I think it's really important for us to be able to use data, as Katie said, and tell the story, but also make sure our story is impactful in being able to draw people together and move things.
So LISC is hosting a book read. May 9th, we're asking folks to come together to agree to host, to be the book host. And if you check the website, because I don't have the place right in front of me. But the reason we're doing that is the book is The Color of Laws. And we think that we need to have a discussion about the intentionality of the segregation that was put forth with where people could live, what housing was supported by insurance, federal housing authority insurance. And that will help us to understand and have the same language for why we have concentrated pockets of poverty in the places where they are. And at that point, I think we can then have a more fruitful conversation about what is needed and why, and people will be able to explain and articulate what has happened that has created our current situation. That is the data that is important from my point of view, is that people actually have the facts, have an understanding of the laws that our government put in place and the policies that were put there. I think then once we have that, we can have a conversation about how we move forward powerfully together, boldly, to ask for something different, to ask how we might redirect money to the places where the poverty has been concentrated. It's sometimes controversial for me to say that I don't always support single-family home ownership in certain places, because home ownership is supposed to be about building wealth and having a steady, stable asset. If you are not going to ever be able to recoup what you put in. If your asset is losing money from the day you move into it, I can't say that that is a good use of your dollars versus another way of living. And I agree that safe housing is absolutely critical for all the reasons that we've talked about, that you've heard talked about today. And so I invite you to visit our website and join us in this book read so that we can have a very real conversation.
I would just say quickly that I think in our community we have many assets. I think we also have many initiatives. We're a community that likes to start things. And I remember from the Ed Sullivan Show, which dates me, the spinning plates. We like to start the plate spinning, but sometimes we don't keep them spinning. And I think we have a lot of well-meaning individuals and initiatives. And what I think funders can help us to do is to make connections and align our efforts more effectively, to invest in things that are working over time, and then to scale those things that are working.
So my answer to what funders could do to drive more social services is, number one, funding innovation, funding redesign of service delivery. Number two, funding integration of those services within other service delivery models. Number three, driving collaboration through our funding mechanisms, which is something we can mandate and really implement. And number four, funding demonstration projects where they're needed, where we need to demonstrate that a particular model will work before we can get more sustainable funding for that. And then five, working collaboratively to advocate for policy change and to seek sustainable funding. We just did all of those steps in terms of care coordination in our EDs, collectively working through the Milwaukee Healthcare Partnership, with Ascension, with Aurora, with WHA and the HMOs. And last week, the governor signed into law an act that will now provide funding to staff similar models in hospitals all across the state. And that's what we need to do to bring things to scale.
So, the question, what social services or other services could we do more funding in? I would say, and you're not going to be surprised, it depends on the people in the place. What we know from our work is really that people define health and wellness in different ways. So, in the Clark Square neighborhood, they talk about health and wellness in four main areas: physical, social, economic, and spiritual. Maybe they've added to that for now, but you can ask Ian about that. But so when Clark Square comes to us, those are the areas that they're really looking at. In Lindsay Heights and Layton Boulevard, some of those ideas resonate, but they really come to us and say, here's what we think is important, what's going to work in our neighborhood. So for us, we can fund those projects. And then the thing that I would add to that, which I think I've never heard it referred to in this way, the triple aim of health equity that Dr. Swain mentioned this morning. Strengthening community capacity. That's something that we really believe in, that we've invested in, and I think if you can strengthen community capacity, you can strengthen the people who live in neighborhoods, help them strengthen their voice, make that voice louder, realize that they have a voice. Everyone is coming to it in a different place, that if you can help them strengthen their voice and be able to speak their truth about what is really needed in the neighborhood, and then support those things in the neighborhood, and then get other funders and partners to support those things. I think that's really what we need to look at when we talk about, what works in a place for people in that place.
So I hope you'll all join me in thanking our wonderful panelists.